The word vaccine has become a buzzword in our everyday language. You always get to hear people talk about this vaccine, that vaccine. People have been vaccinated. This one has been vaccinated, and this one has had side effects and stuff like that. Today, I'd like to have a discussion, a very brief discussion on vaccines. It would be a bit fair if I would start by defining what a vaccine is. And by definition, a vaccine is a substance that is used to stimulate the production of antibodies and provide immunity against one or several diseases prepared from the causative agent of a disease, its products, or a synthetic substitute treated to act as an antigen without inducing the disease. Now, that is basically what a vaccine is. When we look at the reason why vaccines are necessary, or why those people that support the issue of vaccines and vaccination, why they regard that as very important, is that it is believed vaccines help prepare the body to fight foreign invaders. And these foreign invaders are called pathogens. And these pathogens are your bacteria or viruses to prevent infection. So they prepare the body to fight foreign invaders to prevent infection. Now, some people prefer to call them the soldiers for the body system. All vaccines introduce into the body a harmless piece of a particular bacteria or virus, triggering an immune response. They greatly reduce the risk of infection by working with the body's natural defenses to safely develop immunity to a particular disease. So what that simply means is when you get vaccinated for a particular disease, that vaccine will only work against a particular disease or that particular disease. If you get vaccinated for COVID-19, for instance, any other diseases won't be affected by the vaccine that you would have actually gotten, or the vaccine that would have been administered to you, because that vaccine would be specifically for COVID-19. So now they do this, these vaccines actually do this by imitating an infection and using the immune system to produce what we call T lymphocytes and antibodies. So they get, when the vaccine gets to be put into your body, it then gets to imitate that particular virus that will actually be directed to, or which the vaccine will be directed at. And so when it gets to imitate that, when it gets into the body, the virus will think that it is part of the virus, or the vaccine is part of the virus. During the war, we had people that were called sellouts. So sellouts would actually go into an enemy's camp and pretend to be part of the enemy. So that is basically what vaccines do. I spoke earlier on about a pathogen. Pathogen could be bacteria, could be a parasite, could be virus, could be fungus that can cause a disease within the body. Now, if you look at the situation that I've just spoken about, where we're saying a vaccine gets into the body and pretends to be a virus or part of that virus, we're saying sometimes after getting a vaccine, or once you've gotten the vaccine, the imitation infection can cause minor symptoms such as fever, So you get it, and that imitation, the process of imitating the virus, works on your body. It can actually cause symptoms such as fever, and that's what some people refer to as side effects. So when it gets worse, when that fever or the side effects or effect gets to be worse, you really need to immediately seek medical attention. So such minor symptoms are normal and should be expected as the body builds immunity. Once the imitation infection goes away, the body is left with a supply of memory, and we call them T lymphocytes as well as B lymphocytes. Now, these lymphocytes will actually remember how to fight the disease in the future. So the vaccine is in your body. We have the lymphocytes that are left there, and the lymphocytes will have that memory to say at any given time when that kind of virus which they're actually trying to fight against gets to attack the body, they will remember, they will have that memory to fight against that virus. So that's basically what this is all about. Now, however, it typically takes a few weeks for the body to produce the T lymphocytes and the B lymphocytes after vaccination. It is therefore possible that a person infected with a disease just before or just after vaccination could develop symptoms and get a disease. In this case, we're talking about COVID-19, because the vaccine has not had enough time to provide protection. So that's basically what I needed to discuss on vaccine or vaccines and vaccination. In my next discussion, I'm going to talk about the virus that gets to attack the body. I'm going to talk about the pathogens. Thank you so much. Have a brilliant and wonderful day.